This is mirrored from the Bearded Heretic. His link to his channel will be in the description box.
Why are we re-closing down Texas? Because there are more cases. More cases and less deaths would be a good news story because people are getting it and getting over it. That's not what's happening. In fact, Dr. Paul, what's happening in Texas is even more insidious than that. And there have been some information coming out recently about why there's a spike in Texas. The big spike in Texas. You see it in all of the hysterical news. Got to shut it down. Even Abbott, he's not able to stand up to the naysayers. What happened in Texas is interesting. In the middle of May, the Texas Department of Health Services changed the definition of what a COVID case is. And we know this now because the county judge of Collin County in Texas, there was a judge commissioner's meeting where he talked about the changes that came down from on high on how they're changing the definition and the criteria. And he said in mid-May, we're just opening up. I'm worried this is going to cause another spike. Talk about prophetic. We have a clip of the judge, of Collin County judge.
State of Texas, DSHS has informed public health departments that they have adopted a revised definition for COVID-19 probable cases.
So for confirmed case, it stays the same. You still just need PCR. But now they've added a probable case definition. So that still gets counted towards the case count. It's different. It's not confirmed. It's probable, but it's still a case. So at the end of this definition, there are 15 different options on how you could be classified as a probable case. Based on this diagram and what they report, there's a total of 17 cases now. One is still only confirmed because that was that original index case who then had all these contacts underneath in orange. And all the rest of them became probable, but they are still considered a case.
This has the potential to be a very significant event for us here in Texas and here in Collin County as the state now has elected to adopt this new probable definition. If you have a subjective fever and you have a headache and you live in Collin County, you now meet the qualifications to be a probable COVID patient. It is remarkable how low the standard is now. Mm-hmm. If you have one of the major symptoms, you have a cough or you have shortness of breath, and you live in Collin County, then you can satisfy the definition for a probable COVID case. But I'm very concerned that we absolutely could see the numbers jump very rapidly in a way that actually is not indicative of what we're seeing here in the community in the public health department.
He's expressing his concern to his colleagues. Let's listen in for a second.
Best efforts, it will be very hard to get in front of this story. For those that don't know about this case definition, who don't understand it, when they see these dramatic increases in numbers, they're going to be inclined to think either that we've hit some different spike, and now, quite frankly, we have this new pandemic raging through the community, which is a false narrative. That's not at all what that is sharing with us and communicating to us. Or they're going to be inclined to think, well, we weren't doing an honest job with the numbers prior.
And what he's saying is by changing this definition, Dr. Paul, you're going to get a lot of false positives. You're going to get wrong information. And here's a quote from Hill in the papers there. He said, quote, "It's remarkable how low the standard is now. This is mid-May. He's warning you're going to get a spike because you're changing it. I fear this is coming at a time just when we're starting to reopen. If the numbers jump in a false way, it's going to be very concerning to our citizens that we're actually going backwards. The numbers have jumped in a false way, and we're going backwards."
Yeah. Wake up, wake up.
Yeah. And here's what the changes are, Dr. Paul. Before, in Texas, the test must be positive. You had to have a COVID test that came up positive. Late in May, that was no longer needed. Now they're counting probable cases as COVID cases late in May. And what were the criteria to determine a probable, i.e. a COVID case? Any two of the following symptoms, and they don't need to be measured: chills, rigors, myalgia, headache, sore throat, new smell or taste disorders, or any one of these group: cough, shortness of breath, or difficulty breathing. So if you present to a doctor with that and have that, you're COVID.
Yeah.
And I have a few clips, and just the juxtaposition of these two clips I think is interesting. Let's do the next one. This is WHO, those great experts who have been so honest and so accurate. WHO warns some countries may have to reinstate lockdowns as coronavirus pandemic accelerates. The pandemic is accelerating. We've got to go back to lockdown. Let's do the next clip. Here's accelerating pandemic in the U.S. U.S. deaths involving COVID-19. Can't even hardly count them on June 27th. So this is the justification for the shutdown. So let's go to the next one. Here's another one. Here's the things that you notice. Here's Governor Wolf of Pennsylvania, your birth state, Dr. Paul. This guy's a total tyrant. He just expanded the mask-wearing order. You've got to expand it. Pennsylvania is in dire straits. It's coming back. Let's do the next one. Here's Pennsylvania. Look at the death count. It's going down to almost zero. It's a lie. And do one more, actually. And this is hilarious, Dr. Paul. Black Lives Matter protests may have slowed the spread of coronavirus. Not only did it not infect more people, it helped solve the problem. Yeah, right. And look at this, the next one and the final one in this segment. Here's Galveston. No beaches for the 4th of July because you might get coronavirus sitting on that seawall. I think this is really important. The whole new lockdown, it's not quite a lockdown yet, but the governor threatened yesterday, Abbott, the governor of Texas, threatened, and I'm sure other governors are following suit. Hey, if numbers keep getting worse, if we keep getting more cases, we're going to go back to lockdown, so you better put your mask on. Don't you dare go to those bars. The mayor of Houston said, I'm going to make a list of all you naughty businesses and shame you, which is, can you imagine, public servant doing this? Paid by these businesses. But it's all based on these reports coming out of primarily Texas, but also California and elsewhere, that hospitals are being overrun. That's the reason. That's
No,
the
they're not.
scare.
I live here, man. They're not
95%
overrun.
capacity.
Matter of fact,
And
they're
I wanted
empty.
to do a couple of things. This is a couple of this is a message sent by one of the directors of emergency rooms in Houston. But first, there's a couple more clips before we get to that because I think it's important. This one, Dr. Paul, we like to talk about what really matters. And these are deaths. Each line represents a specific age group in the U.S. for COVID-19. And, of course, the bottom axis is the time axis. We're here just past, we're a little 10 days out of this, which is updated on 6/20 of 2020. That chart says everything. Coronavirus is, if not completely dead, is dying. People aren't dying from it. And that's why they're hyping the new cases. It just says it all. Let's go to the next one. And this is, I'm going to be quick, but this is sent to Alex Berenson, who's doing a terrific job. He's a former New York Times reporter, does a lot of great work on Twitter. Let's leave that up, please. A lot of great work on Twitter. He got an email from the managing partner and general counsel of a Texas-based company that owns and operates 13 emergency clinics in Texas. He wrote to Alex Berenson, I follow your reporting, wanted to share some information on Texas. I want people to hear this. He said, and I'm going to skip down. In June, we tested over 2,231 patients. The positive rate is now close to 20%. Let's hit the next one. Versus 4 to 6% positives in May. The vast majority of the cases are mild to very mild symptoms. Average age of people getting tested is mid-30s. Very different patient in terms of age than we've seen before June. Most of these patients would not have met the strict criteria that we previously had for testing, right? Now all of a sudden they can get testing. With more testing kits, we can do a broader group. He says we've had very few hospital transfers because of COVID. The vast majority of the patients are better within 2 to 3 days of the visit, and most would be described as having a cold, a mild one at that, or symptoms related to allergies. Usually we provide a steroid shot and some antibiotics, and it seems to get better. They say it makes a difference to do that. In terms of the ER, we're almost done, Dr. Paul, but in terms of driving them to the ER, roughly half have been told by their employers to get a test. Let's go to the next one. They had a sneeze, something like this, and their employer said, hey, go get a test. You need to get a test, because tests are easier to get now, essentially is what's happening. It says the average stay of COVID patients is 3 to 5 days, much lower than the patients that were seen in April and May. Their symptoms are also milder. Most of these patients are not in the ICU. The ICU units are filled with really sick people, and they're non-COVID issues. They didn't come in earlier, and this is what you've said before, Dr. Paul, because they were too afraid to go in, and now they're super sick, is what this administrator said. Let's go to the next one. This is, I think, almost the last one. And he said no real breakdown on the patients who've had COVID who are not in hospital because of COVID. So we've heard stories of how discharge planners are being pressured to put COVID as primary diagnosis, and that pays significantly better. Hospitals want to avoid this discussion, but if they don't, they risk another shutdown. It may be an explanation for why there's a gap in executives. So just do the final one now. This is the last, his conclusion. Overall, based on what we're seeing in our facilities, the above information is really more of a positive story. You have more people who are testing positive with minimal symptoms. That means the fatality rate is less than commonly reported. I'm sorry that was long, but I think that's really fascinating. This guy's in the business. He's saying, this is what we're seeing.
Well, to me, that's all very important, but I think the most important chart that appeals to me is the one where it goes up and down to zero. And I was thinking, if we could take that chart and not label anything and show it to 10 independent epidemiologists and tell them this is a record of an infection. Tell us where we are on this. It's over.
Yeah.
I mean, it's down to the baseline, and they haven't quite admitted that yet. But that's what they should realize. But I think it should be announced. Why don't we announce today? It's essentially over, and it's come back to sanity, because it was essentially never as bad as they claimed, although it was bad because of some of the things the way they were treated, the misunderstanding, how it was politicized, and yet the lockdowns are now turning out to have been every bit, if not worse, than the epidemic. So this is the reality that has come about.
Governor Janet Mills of Maine, not a super central state, but she's got to be the villain of the week. Yesterday she announced she's going to toughen the mask requirements. Don't you dare go outside with a mask, mandating that businesses wear masks. She's killed tourism in a state where tourism is a real driver of the economy. It's all gone. So you ask, well, what's going on in Maine? It sounds pretty bad. New deaths, new crisis, death spike. Are they running out of beds? Are they running out of ventilators? Well, let's look at the statistics from Maine. Here it is. New deaths, 0. 0. Hospitalizations, 29. Total ICU beds, 398. Available, 132. Total ventilators, 317. Available ventilators, 250. This is the crisis that's caused Janet Mills to go back to putting on your mask or go to jail. And here's the next one. Here's rules for thee, but not for me. Here's old Janet going out, having an ice cream. She's not social distancing. She doesn't have a mask on. She's visiting with her fans. Even worse, and this is what really finally convinced me, is the next clip, Dr. Paul. They're putting up signs in Maine telling people how you have to dress to prevent corona. You can wear a tank top, but don't let the sides show. I mean, if you look at this, it is so absurd. It's almost like the Taliban have taken over in Maine.